Is recent advances in regenerative medicine and orthobiologics by Professor Paula Romero. Please.
Hello, I'm Professor Dr. Chris Paulus. I'm the Executive Director of the American Board of Regenerative Medicine. I would like to thank the PASS organization and its leadership for this opportunity to provide an update on the current status of orthopedic regenerative medicine. Orthobiologics have evolved remarkably over the past 2 decades, transitioning from experimental interventions to evidence-based therapies. As the global population ages and degenerative musculoskeletal conditions, as well as sports-related injuries, become more prevalent, the orthopedic community is witnessing increased demand for biological solutions. This lecture will explore the scientific and regulatory foundations of these therapies, as well as their clinical integration. Our discussion will unfold in 5 structured sections. First, we will examine the US FDA regulatory landscape and how it shapes clinical practice in the United States, as well as its global impact. Then we will evaluate the evidence basis of orthopedic regenerative medicine, followed by a review of clinical relevance, practical considerations, and finally, emerging directions that are reshaping the future of orthopedic care. In the US, biologics are regulated under 2 main categories, HCTP 361 and 351. HCTP stands for human cells and tissues, as well as their related products. The 361 product designation applies to minimally manipulated, homologously used products, such as PRP and bone marrow aspirate concentrate, while the 351 designation governs culture expanded cells and allogeneic products, which require a full biologics license application. Although some orthopedic applications of 351 products are technically unapproved, enforcement has been inconsistent, enabling some clinical use. However, 361 products, minimally manipulated, homologous use, and autologous applications make up the great majority of US orthobiologic products. Autologous biologics like platelet-rich plasma and bone marrow aspirate concentrate are widely used due to their relative regulatory simplicity and a known safety profile. PRP involves concentrating platelets to release growth factors that enhance tissue repair, while bone marrow aspirate concentrate provides a rich source of progenitor cells as well as cytokines, including growth factors. Microfragmented adipose tissue, which preserves stromal vascular niches where mesenchymal stem cells reside, is gaining acceptance as a minimally manipulated human cell and tissue product. These therapies are often used in outpatient settings and are well tolerated, making them accessible for a wide range of orthopedic indications. However, outcomes are highly dependent on preparation techniques, patient factors, dosing, the specific pathology, and other variables. Advanced biologics, such as culture-expanded mesenchymal stem cells, are classified under a more stringent FDA criteria due to manipulation and potential of systemic effects. These products often require extensive preclinical and clinical trial data to receive approval. Despite regulatory hurdles, their clinical use continues to expand globally, especially in private and academic centers. These therapies show promise for more complex or chronic musculoskeletal conditions, but must be used with clear ethical and regulatory boundaries. Providers must also stay updated on international regulations if offering treatments across borders. This landmark state law in the United States state of Florida, home to 23 million people, is entitled Florida SB 1768. It permits the clinical use of culture perinatal stem cells that includes umbilical cord sources, amniotic sources, and others, provide perinatal cells for orthopedic conditions, and is approved as such, effectively creating a localized regulatory pathway in the United States. Also, it doesn't supersede federal law. It may serve as a prototype for future state-level reforms. In fact, a number of US states are following suit with this particular legislation. This represents both an opportunity for innovation and a challenge to regulatory harmonization. The law reflects growing public and legislative interest in regenerative medicine access and may encourage similar efforts elsewhere. However, it also raises questions about standardization, oversight, and long-term safety. However, it is an interesting exception to the typical US FDA regulations, which in this case does permit the use of culture-expanded perinatal stem cells for orthopedic applications. Here's a table of orthobiologic procedures performed in the United States in 2024 by specific target sites, including the knee, shoulder, hip, spine, small joints, and soft tissues. And we can see platelet-rich plasma, bone marrow aspirate concentrate, adipose tissue, and stem cell exosomes, which are secretions of biologic materials by stem cells, as categories of specific product use in orthopedic regenerative medicine. We can see numerically how each biologic is utilized by specific applications to musculoskeletal areas. In total, we can see that PRP, or platelet-rich plasma, has been utilized the most, with over 750,000 applications in orthopedic regenerative medicine. Bone marrow aspirate concentrate provided over 500,000 procedures in the United States, again by each musculoskeletal area. Adipose tissue or cells were used in over 300,000 patients. And finally, stem cell exosomes, again, secretions of growth factors, chemokines, cytokines from stem cells, have now become a product in use as well, and were used in over 150,000 patients. So I think these numeric assessments provide you with a general idea of the commonality of the use of orthobiologics for patients in the United States. In terms of the evidence basis for orthobiologics in knee osteoarthritis, there are multiple level 1 randomized controlled trials, as well as meta-analyses that have demonstrated the superiority of PRP over corticosteroids and hyaluronic acid in managing knee osteoarthritis. Bone marrow aspirate concentrate also shows significant benefits in joint preservation, especially in early to moderate stages. These findings support the integration of biologics as first-line adjuncts in non-operative management protocols. Importantly, both pain relief and functional improvement have been observed with biologics, often delaying or replacing the need for surgical intervention. Clinicians must assess patient phenotype and disease stage to optimize biologic therapy selection. In this table, we can see some of the evidence bases specifically for orthobiologics in knee osteoarthritis. In this particular table, we will look at the evidence for PRP. We can see PRP and knee osteoarthritis from the Journal of Orthopedic Trauma and Surgery from 2023. This is a meta-analysis of 31 randomized controlled trials with over 2,700 patients. In conclusion, significant improvement in pain and function was found. In the next study from the European Journal of Orthopedic Surgery and Traumatology, 2020, a meta-analysis of 12 randomized controlled trials and over 1,200 patients, again, significant improvement in clinical outcomes. Lastly, PRP and knee osteoarthritis 2023 from the Clinical Journal of Rheumatology, a meta-analysis of 14 randomized controlled trials with almost 1,300 patients, significant improvement in pain and function scores. This is a quick look at some of the level 1 evidence supporting the use of PRP in knee osteoarthritis. Here's a look at the regenerative medicine evidence in terms of the use of stem cell products and knee osteoarthritis. You can see here in the British Medical Journal from 2022, a meta-analysis of 6 RCTs in almost 500 patients, utilizing mesenchymal stem cells and PRP in combination. In conclusion, the authors found good clinical efficacy in pain and function. American Journal of Sports Medicine 2023, meta-analysis of 5 RCTs utilizing adipose-derived stem cells showcased remarkable efficacy and safety. Indian Journal of Orthopedics 2022, 21 RCTs with 936 patients utilizing mesenchymal stem cell products, efficacy for pain, functional outcomes, and safety. We'll highlight one more. This is from the American Journal of Sports Medicine in 2021, a meta-analysis of 19 RCTs from 444 patients, level 1 evidence, utilizing mesenchymal stem cells, again, improved functionality. So we can see the evidence basis for stem cell products for knee osteoarthritis is quite broad, with not just individual randomized controlled trials, but meta-analysis based on many randomized controlled trials. We will now take a look at hip osteoarthritis and orthobiologics use. Intra-articular injections of PRP and mesenchymal stem cells have shown statistically significant improvements in hip pain and function in terms of osteoarthritis. Meta-analyses support these findings, indicating reproducibility across patient populations. The adoption of biologics and hip preservation surgery is accelerating, particularly in younger patients with early disease stages. These treatments offer a valuable option before considering joint replacement, especially for active individuals. Nonetheless, patient education, patient selection, and the proper use of biologics are imperative in terms of providing for the ideal outcomes. Here's an overview of the evidence basis for PRP in hip osteoarthritis. American Journal of Sports Medicine 2023, 8 RCTs, over 330 patients utilizing PRP. In conclusion, significant reduction in pain and improvement in function. International Journal of Medicine 2018, meta-analysis of 4 RCTs in 380 some patients, significant improvement in pain. And lastly, again, the American Journal of Sports Medicine from 2016, randomized controlled trial of 111 patients, stable clinical improvements with the use of PRP for hip osteoarthritis. In this table, we can see some of the evidence bases for ONFH, osteonecrosis of the femoral head, and the use of orthobiologics. We can see a study from 2020 published in Medicine, a meta-analysis of 16 RCTs and 688 patients utilizing bone marrow stem cells for ONFH. In conclusion, improvement in pain relief and clinical outcomes. We can also see the use of PRP supported by a British Medical Bulletin from 2021, a meta-analysis of 7 RCTs and 656 patients. Again, an improvement in the condition. In general terms, the use of orthobiologics for ONFH is typically used in conjunction with core decompression, utilizing bone marrow aspirate concentrate. In terms of the evidence for rotator cuff pathologies, PRP has been used as a surgical adjunct and has shown to reduce re-tear rates and enhance tendon healing post-rotator cuff repair. Similarly, bone marrow aspirate concentrate and mesenchymal stem cells improve the tendon-bone integration, leading to better functional outcomes. These therapies are supported by level 1 evidence and increasingly form part of advanced shoulder repair protocols. Biological augmentation is particularly helpful in revision cases or large massive tears when native healing potential is compromised. Continued research is focusing on identifying the ideal timing and delivery method of these adjuncts. Partial thickness rotator cuff tears benefit substantially from biologic augmentation, particularly in reducing inflammation and facilitating repair. Patients experience faster recovery and lower pain scores postoperatively. Longitudinal studies are beginning to show sustained functional improvement beyond 2 to 3 years. These biologics may help preserve tendon integrity and function, potentially delaying the progression to full thickness tears. As outcome data mature, these therapies may become standard care in biologically appropriate cases. Here's a quick look at a table of the evidence basis for PRP and shoulder pathologies, we can see level 1 evidence from 2022 in the International Journal of Sports Medicine, a meta-analysis of 9 RCTs and 540 patients. PRP provided an improvement in clinical function and a reduction in re-tear rates. Journal of Arthroscopy 2021, meta-analysis of 17 RCTs and 550 some patients, significant reduction in re-tear rates. This is just a quick snapshot of some of the evidence bases of PRP for shoulder pathologies. In this table, we'll look at the evidence basis for stem cell use in shoulder pathologies. We can see here from the Orthopedic Journal of Sports Medicine in 2022 a network analysis of 760 patients where bone marrow stem cells were utilized for shoulder pathologies. In conclusion, reduced revision surgery rates were shown in this network analysis. In the Journal of Orthopedic Surgery and Research 2020, randomized controlled trial of 84 patients with adipose-derived stem cells showed an improvement in shoulder function and also documented safety. There are also other level 2 studies supporting similar orthopedic assessments. In terms of tendinopathies, chronic tendinopathies such as lateral epicondylitis and patellotendinitis respond well to biologics like PRP. Randomized controlled trials demonstrate functional improvements and durable pain relief compared to corticosteroids. For Achilles tendinopathy, biologics may enhance tendon remodeling and reduce recurrence. These conditions often have poor healing due to chronic degenerative changes, making biologics a promising alternative to repeated injections or surgery. Selection of the appropriate biologic and timing within the disease course remains subject of ongoing study. Cartilage repair using mesenchymal stem cells embedded in scaffolds shows superior outcomes to microfracture alone. These constructs promote better tissue integration and longer durability. Young and athletic patients tend to derive the most benefit, making this a valuable option in sports medicine. Advances in biomaterial science have enabled the development of increasingly sophisticated delivery systems that mimic the native extracellular matrix. Early identification of cartilage lesions improves treatment outcomes significantly. Biological augmentation is particularly valuable in the treatment of complex meniscal tears. Scaffold-based mesenchymal stem cell delivery systems are being explored to improve healing rates and maintain joint integrity. Early data indicate a promising role in joint preservation strategies. Successful biological repair may delay or avoid meniscectomy, preserving long-term joint health. Continued research will clarify which tear patterns and patient profiles benefit most. In this brief review of some of the evidence bases, which is supported by a much broader evidence-based selection, orthobiologics are now supported by a growing body of randomized controlled trials, systematic reviews, and meta-analysis, transitioning from adjunctive options to a potential for mainstream interventions. Their integrations into practice is especially relevant in early to moderate disease stages and sports injuries. As patient awareness increases, the demands for these therapies continue to rise. Clinicians must be prepared to discuss evidence, costs, and alternatives transparently. Incorporating biologics into treatment algorithms should be based on guidelines and individual patient factors. Despite promising outcomes, barriers such as cost, reimbursement, and some degree of a lack of standardization remain. Variability in preparation protocols can influence clinical efficacy. Ethical patient selection based on indication and available evidence is essential to maximize the benefit and minimize any potential harm. Surgeons must also consider logistics such as facility capability, team training, and follow-up protocols. Shared decision-making with patients is critical, especially in cases with limited high-level evidence. In terms of risk management, surgeons must navigate the regulatory framework carefully to avoid legal liability and ensure patient safety. Informed consent is crucial, particularly for off-label uses. Participation in certification programs and continuous education can help mitigate risks. Additionally, documentation of treatment rationale and patient outcomes is essential. Providers should also stay updated on evolving jurisprudence around regenerative therapies and the evolution of further scientific evidence. Research is progressing towards even larger scale multi-center trials that will further validate biological therapies. Allogeneic off-the-shelf mesenchymal stem cell products and gene-edited biologics are in various stages of development. Exosome-based therapies and tissue-engineered constructs are likely to play a major role in this next decade. These innovations could make regenerative therapies more standardized, accessible, and cost-effective. Integration with digital health tools and imaging biomarkers may also enhance outcome tracking. Orthobiologics are central to a paradigm shift in orthopedic care, aiming to preserve native joints rather than replacing them. This has the potential to delay or even obviate the need for arthroplasty in many patients. As the field matures, regenerative approaches are poised to redefine surgical algorithms. Patients increasingly seek alternatives to invasive procedures, and biologics can fill that therapeutic gap. However, broad clinical adoption will depend on continued evidence generation and policy reform in some cases. In conclusion, orthobiologics offer a powerful, evidence-supported avenue for joint preservation and functional restoration. Regulatory frameworks are evolving, but must be adhered to with diligence. Orthopedic surgeons are uniquely positioned to lead this biological revolution in musculoskeletal medicine. Your role will be critical not only in applying these therapies, but also in educating peers, advancing research, and advocating for responsible innovation. The future of orthopedics will be increasingly regenerative, data-driven, and patient-centered. This concludes a brief review of the current status of orthopedic regenerative medicine. I would like to thank you for your attention. I would also like to thank the PASS organization as well as its leadership for this opportunity, and I wish you a wonderful Congress.